could change. Live in the newsroom, Henry Rossoff, Fox 6 News.
Well, Boston has some of the best hospitals in the world, and today they were certainly put to the test.
More than 140 wounded, some with limbs missing. It looked like they had been through war. Jeremy Ross, he's been talking to some of their medical colleagues here. Jeremy's in studio with this part of the story.
Well, there are a number of level 1 trauma centers in the Boston area. Those hospitals best equipped to handle this kind of trauma. Frederick Hospital carries that same label. Tonight, local doctors and law enforcement professionals talk about the challenges faced in Boston. Boston is more than 1,000 miles away from Milwaukee, but what started at the marathon finish line brings close connections to area doctors.
There is really no reason for these things to happen.
And first responders.
It was actually pretty horrible to see.
Brian Doro is the Dean of Criminal Justice and Homeland Security at Waukesha County Technical College. He helps first responders like those in Boston hone their skills for situations like the explosions at the marathon.
We've rewritten curriculum. We really reached out to our first responders.
Doro says the lessons from other coordinated attacks on U.S. soil have altered how police and firefighters approach their jobs in this kind of chaos.
They're going to arrive trying to assist the victims. That's always our first concern.
The blast injuries are different. They're not only penetrating injuries from all sorts of pieces of metal.
Dr. John Weigelt, trauma medical director at Frederick Hospital, says the injuries suffered at the marathon are more like the kind you'd see in a war zone, called blast injuries by surgeons. They are a complex type of trauma, far from the typical car crash or gunshot injuries in most ERs, providing challenges for Boston doctors.
It's almost like a blunt and a penetrating. In other words, combine a car crash and a gunshot wound together.
A trying day for police, firefighters, and physicians, one the city of Boston and beyond may not forget.
It is very difficult. It is very difficult.
Now, Doro says as early as tomorrow, WCTC will begin looking at this incident to see how law enforcement can improve in their training. As for the health angle, some of the world's best medical minds and doctors call Boston home. Tonight, those doctors are likely hard at work. Ann and Ted.
Yeah, sadly they are. Thank you, Jeremy.